And your life.
Kala,
Yep.
yeah, we are yet to start.
Right.
That's it. All the best.
Oh, Pallavi's out.
I think we're live.
Yeah.
I
Oh,
think
we
we
can
are
start.
live.
Yeah. Hi, good evening, and wishing all a very happy Doctor's Day.
Thank
I
you.
am Kala,
Thank you.
and I'm just starting in. I'm just waiting for my co-host to join in. She just got disconnected.
Okay.
So, with the current situation that we all are in, it is very, very important for us to take care of our health. Women, especially, they always put their health in the back burner. And they have all other priorities which they give importance to apart from their own health.
Right.
Agreed. And I'm so glad Wiki Karnataka has organized this amazing panel of doctors and nutritionists, fitness coach for us to understand more about women's health and overall wellness.
Wiki focuses on women empowerment with a collective strength of 25,000 plus members across 120 countries. Wiki Karnataka HR Council is an ambitious initiative which is led by Shikha Gupta as president and Rani Srinivas as vice president. They have identified and gathered a group of accomplished women from diverse organizations and various professions to create a platform where women come together to make a difference.
We are delighted to have Dr. Akshaya Sairam, Dr. Shonali Dasgupta, Yash Kaushik with us to talk exactly about women's health and wellness. Dr. Akshaya Sairam, a super vibrant doctor who specializes integrative medicine with yoga and naturopathy. Naturopathy and yoga are a true calling. She is a co-founder of Holiness along with her sisters. They have programs to cure people through a healing journey using a holistic approach inspired by her mother. She took to alternative approach to healing. Welcome, Akshaya.
Thanks for having me. Thank you.
And Dr. Sonali Dasgupta is a homeopathic doctor based out of Ahmedabad with 20 years of experience. She not only solves the health issues of her patients, but also focuses on their overall wellness. She has done back flower medicine for mind disorders at the Regent University in the UK. She has also completed her advanced course in diabetic management from Docomode and COVID management with Government of India Ayush. She has taken care of over 100 COVID patients who have made a complete recovery. She is looking to start her second clinic in Ahmedabad soon. Welcome, Dr. Sonali.
Thank you, Kala. Thanks a lot.
Yash Kaushik, always been into fitness and sports. A life-changing event got him thinking about fitness in the real sense, nutrition and exercise. He soon armed himself without with with over 12 certification covering all aspects of nutrition and fitness. He started his journey to help others. Today, he has changed the life of over 1,800 people most based out of US. He specializes in women's health, dealing with PCOD, PCOS, thyroids, etc. A nutrition consultant and was featured in Men XP magazine. Welcome, Yash.
Thank you. Thank you for having me amongst these well-known people. Thank you so much.
Welcome, and let's get started. So we start with what are the key health issues that female face today that we see increasing every year?
Go first.
Yeah, Dr.
What
Akshay,
are the key health issues that female face today that we see increasing every year?
Okay, so if we see the global causes in women's health, the global causes of illness when it comes to women, like contrary to popular opinion, we would think it would be something related to the reproductive issues when it comes to women. But it's actually number one is cardiovascular diseases, number two is cancer of the skin, of the intestine, and of the breast. Number three is osteoporosis. Number four is depression, and number five is Alzheimer's. So these are the top five. So I'm glad that there has definitely been evolution in women's health when it comes to the progress, because before 10 years, 20 years back, it used to be maternal mortality. And I'm glad we're out of that phase and we're going towards a progressive future. But now the thing that seems to have taken over the globe is non-communicable diseases, or in very simple terms, diseases that are caused due to inappropriate lifestyles. This is what's feeding the world right now, and this is essentially what's taken over women's health.
I would like to add. I would like to add to Akshaya's thing. Yes, definitely, Alzheimer's and breast cancers are taking a great toll on women's health. Because the rate in which the females are suffering is more than men and these things. But apart from the breast cancer, we do have other cancers also, like we have cervical cancers and ovarian cancers, which are often neglected and diagnosed quite late. You will be surprised to know that lung cancer is also one of the second most reason for females' death in India. So even if the women are non-smokers, they do get lung cancers. Then, like the basic, like in my clinical practice, I keep seeing people with chronic fatigue syndrome, very common in women, which is very hardly we talk about it. It's like a fibromyalgia. The women keep coming with aches and pains here and there, and we just contribute that okay, it's just the household chores that you must have done, and you have this pains. But actually, it is a syndrome wherein your muscles are so fatigued, and you do get those severe pains here and there. Then comes mood disorders. People hardly talk about this issue these days. So there is a whole big bunch of people coming up with depression, irritability, PMS syndromes, and you have rheumatoid arthritis in females. You do have migraine headaches, more common in females. You have because all the autoimmune disorders are genetic, have a genetic dispositions, and they are like chromosomal linked. So we have more prevalence of autoimmune disorders in females, like SLE, lupus, and thyroiditis, if I say, and even diabetes type 1. So these things, unfortunately, a female body is really more prone to have all these things, and it's a huge set of medical illnesses one has to really deal with when we being women, we are considering our health.
Well, I think the question was the key problems, right? So I think if I start talk about key problems, like what Dr. Akshay and Dr. Sonali has mentioned, are statistically they are like most prevalent in females. But when we talk about key problems that are increasing every year, I generally, from a practical point of view, when I coach so many females, I think I come across maximum issues which are related to lifestyle disorders. Number one being PCOD, number two being thyroid. These are two most common, and then the other things which are linked to it, like depression, obviously is linked to it. On the other hand, you have diabetes; it's linked to it, right? Because PCOS is also four different kinds. Most common is the insulinogenic PCOS. So if I talk about the key issues, these are the key issues, and I think that's what we should look into it when it comes to increasing year by year, because these are increasing. That's my point of view.
Also, I would like to ask, I'm sure, even Akshay would, he would agree with me when we say that. I'm sure many of the time you find that it's always the men who are more, interested in taking care of themselves, or even the women. They are more interested in taking care of their families and the kids. And though they are working women and do a lot of work, they are the self-center of the house, etc. But still, you find that their well-being and their health is always put at the back. So why do you think it happens like that? So maybe we can,
I'm sorry, you were saying something?
No, go ahead. Yeah.
So we all know that it's a very integral role when it comes to maintaining the health of family establishment. And it's also known that women access healthcare more than men, for themselves and on behalf of their children. And women, some of them get pregnant, they deliver, and that's a very huge turn in the health event of one's life. And also, women happen to live longer than men, so they have to deal with all those chronic age-related illnesses that many other people don't have to deal because of the estrogen protection. That's a whole other story. So you would think that, like women being accessing the healthcare system so much, like we would be somewhere, like the emphasis on healthcare for women would be a lot more, but it's not the case, especially when it comes to, I feel, dysmenorrhea is a condition that's associated with periods, so it's basically a painful period cramp. And I've noticed that there's a lot of ignorance and apathy in that particular sector of life, where because people are just not aware of the pain. And recently, a study or a literature was published, I think, about a year back, where it was proven that some women experience such an astronomical amount of pain with dysmenorrhea that it can be compared to what a pain from a heart attack feels like. That's how terrible it is. But women are expected to go throughout the day like they normally would. They expected to do the work like they normally would. And the lack of empathy is really what shocks me. I know that the lack of empathy comes from a lack of understanding. The lack of understanding comes from a lack of literature, a lack of research in that field. So, yes, there definitely is a lot of ignorance when it comes to women's health. And I think there are lots of hypotheses for why that is. I think the number one thing is like we understand health ailments and illnesses from the point of view of a man. So a man's perspective. So in the panel, if you see, there's a lot more men in the research panel who are there who are like administering the rules. So like it's research is conducted for men by men. That could be a possibility. I'm not saying that that's the possible. That's the truth of it. And also the case is women weren't required to be a part of clinical studies. I think the year was up until 1993, because up until then, the people would say, oh, the woman's body is too complex, with all the hormones and all of that. So they would exclude women from clinical studies. So there's not a lot of data before 1993 because of that exclusion. And another thing also which doesn't involve all these controversies is like women's health is just maybe it's not interesting when it comes to the field of research, because there are other interesting things like genetic studies and cancer and cardiovascular diseases, and researchers and PhDs, they just tend to apply for grants along these topics. So inadvertently the funding and the grants go to the topics that are seeked out for. So it's just not interesting for researchers to take up things like, oh, let me take PCOS instead of genetic disease. That's essentially what's happening, I think, at the end of the day. I don't think there's a very large bias. It's just a matter of interest.
Anything you would like to add?
Dr. Sonali, you would like to add anything to this? Sorry, Dr. Sonali, you're on mute, I guess.
Yash, would you like to add something?
Yeah, we
I
can
think,
hear
I
you.
think
Yeah.
yeah, please, Dr. Sonali, go ahead.
Yeah, I was just telling that Dr. Akshay has really elaborated and explained the cause very well. I would like to, as a doctor, I would like to stress really we need a lot of clinical trials on female disease, because that's really disheartening to know that the researches are done from the perspective of a man and by the men actually, and only 70% of the clinical trials are happening on females. So, and female body throughout the menstrual cycle, each one of us, like we are 4 females and on this panel right now, we might have different reactions to medicines and diseases at every day depending on our cycles. So when it comes to clinical trials, they don't even include females into it because of this hormonal imbalances happening in their body. But just I wonder, how can then one single medicine can cure all the female, or can be compared to what best results are in men, the same can be for females. Secondly, we as women, we have to stand up for ourselves. We have to be a little bit more aware about our health issues. We should know when to raise that alarm. Yes, these things are not the normal ones, and we have to seek the medical help on time. So we should be knowing about the health insurances. We should be knowing about what is actually going inside our body, and really we should talk about it. because many times, the female is suffering for years and years, and she even doesn't know that this is not normal. So that is what my concern area, when I really feel pity for these women who don't even know that, like, there's urinary incontinence and all this. They take it as like, okay, it's happening. But no, this is happening because of the recurrent subclinical UTI that you have. It is thyroid they just ignore, and these can really create havoc in their health. Thyroid is like, Yash would agree that people don't the clients that he must be handling, they hardly lose weight with thyroid. They have so much of mood swings, they have so much of bloating, water retention. People don't understand the importance of all this, and we have to stand up for ourselves. See, it's easy to blame the others. It's better, as we are conquering all the spheres in life these days. Women is like a superpower, and really heading towards and taking a pivotal role in all the aspects. We should be taking charge of our health in our hands, I feel.
What, with this hectic lifestyle, what is the best routine you think we should follow? Like we females, we should follow.
So I personally think that by just making slight changes in your daily routine, you can go a long way. Starting off with what you drink the first thing when you wake up in the morning. Usually people go for like a chai or a coffee. I suggest start off with at least 2 to 3 glasses of lukewarm water, because A, it's going to help clean out the GIT, the gastrointestinal tract. B, it's going to really help flush out the kidneys. And C, it's going to initiate peristalsis. The movements of the large intestine to remove the toxic waste from the day before, remove your so just to clear out your motion in the morning. So before you go for tea or coffee, just have 2 or 3 cups of warm water on an empty stomach. That would really benefit you. That would go a long way with that. Second thing is, some sort of physical activity in a day is really important, because we're so used to sitting in front of computers all day long, or sitting in front of a TV, or just sitting. Really forgot to move. We forgotten to let that movement exist. So even if it's 10 Surya Namaskars a day or 8 Surya Namaskars a day, just going for a walk for 30 minutes, you could really benefit from that. And the last thing I'd like to add is, we are, regardless of what people are doing, we are going to eat 3 times in a day. We might as well make the most of that. So if we eat right, if we follow the step-by-step method of eating the right way, again, that's going to take us a long way. So number one, digestion begins in the mouth. So we all lead this fast-paced lifestyle. You get to choose, like food like twice, and you just follow it immediately. So maybe if you could be more conscious of chewing your food, utilizing, your salivary acids to digest the food in your stomach, because digestion begins in the stomach. You could really spare your stomach and your gut all the load that you're giving it on a daily basis when it comes to digestion, assimilation, absorption. I think essentially, if you just follow these things, it should be enough to have like a decent lifestyle.
I would like to add one thing which I keep battling in my clinical practice. I would like to request all the women, please do have your breakfast. There is no excuse for having a breakfast in the morning. You might be running around behind the kids and husband, serving them sumptuous breakfast. Please do have it for yourself, because that is the first food that you have. It's a kind of a super meal for the day. It kickstarts your metabolism, and so that's very important. As what Dr. Akshay has added, take water, everything, chewing food, but please do have a healthy breakfast, because that's a key to your health, and do not compromise on that.
Yes, yes.
But not if
Well,
Yes,
I agree with the concepts to some extent. But definitely I beg to differ in some cases. I say that the key for anything when it comes to health, for men or women, doesn't matter. The gender bias is not here. Sleep is the key. If you sleep well, that's when your digestion, your amylase, your stomach, or all those things would act up normally. If your sleep is not on point, you are done for the day. Your biggest lifestyle issue is Netflix, it's Prime videos, it's watching online series late night and sleeping at 1, 2, just screwing up. I'm sorry for my language, but screwing up for the entire, the circadian rhythm. There's a circadian rhythm of a body, which is a rhythm in which your body releases hormones, a rhythm in which your body acts up the entire day. When your digestion is happening, when your sleep hormones are releasing, when your cortisol, your testosterone, your estrogen, everything is dependent on that. And if your sleep is not on point, your circadian rhythm is not on point, then nothing would work.
Everything.
It doesn't matter. Whatever you eat, nothing matters. Breakfast is super meal and everything. Definitely that's something that I would beg to differ. Obviously, breakfast has always been a very important meal of the day, but it is not something that is really that important, which I would say a key. I would say sleep is much more important. What you eat in the entire day, you should look at that. And when you eat that, that depends. Like in some cases, we also suggest females to fast. We do intermittent fasting. What happens in intermittent fasting? You miss out your breakfast. You eat your breakfast later after afternoon, right? So that's what you do in intermittent fasting. So
See,
breakfast I would not keep as a key,
no,
but I would
Yash,
say
I
that
have,
sleep is.
yeah, like the way you beg to differ, even I beg to differ. See, there is a different thing. When we talk about Ayurveda, when we talk about homeopathy, when we talk, different sciences have different concept about fasting and all that.
True.
For me, I'll tell you what science is. Science is like stomach is an involuntary organ, just like a heart. We never want our heart to take rest. Similarly, stomach also is an involuntary organ which has to continuously churn the food. So intermittent fasting, yeah, I vouch for it. I go for it, but it should be in the night. Like if post 8, you should not eat anything till 9 o'clock. But many times I've seen women just having hit the gym, come back from the gym, then also they are not having their breakfast on time, and they had directly hit on the lunch. You as a trainer might definitely agree with me that metabolism usually starts at 3 or 4 a.m. in the morning. That's the highest, that's the peak for our metabolism to, it's at the highest level. It starts from that time and it reduces by the time 7 p.m. And that is why we traditionally we never used to eat our dinners post 8, and that's so true, because post 8 p.m. everything that you're going to eat is going to get converted into a fat because you hardly have any metabolism to churn it. So stomach, yes, Ayurveda definitely there can be a mono diet, there can be a liquid diet for a day to cleanse your system, but do not eating. Like I'm a diabetic for 16 years. I have been advised intermittent fasting. I am following it. I am getting results of it. But I stop my dinner at 8 and then I start in the 9 in the morning with a good, nice, healthy breakfast. I'm not saying eat whatever is available. It's a healthy breakfast I'm talking. But that definitely boosts the immunity. So I think from clinical perspective, I've seen results. So I think you are also right. Sleep definitely is the precursor of the breakfast. So I said sleep, then the breakfast, and then rest of the routine.
It's absolutely right. My next question would be, I will start with Yash, because when he mentioned nowadays you've seen that there's a lot of PCOD, PCOS, thyroid, etc., which are the normal ailments, whereas these were not heard of earlier. Was it because of they were not aware of this kind of ailments, or is it because there's any kind of a change that is happening now? So many ladies, especially, are suffering from these ailments and they're not able to conceive, etc., because of these issues. So, what do you think? Is it that now we have these issues that are coming up, PCOD, PCOS, and thyroid? To start with, Yash.
So what do I think about these things is definitely they are growing, they're increasing. Globally, it's I think somewhere around more than 20% now in females. So I think yes, it is increasing. But I think this question I would rather answer first. I would like to see a doctor's point of view, and then I would definitely like to answer this. Because I think this is more of a clinical question rather than my training perspective.
We'll go to
Yeah.
Dr. Sonali next. We'll go to Dr. Sonali. Yeah.
See, PCOS, yes, as we call it, PCOD and PCOS both. First of all, it's the cause of it's very ambiguous. People don't know right now. The researchers have not been done that much that why it is happening, but definitely there is a correlation with genetic and environmental factors attached to it. These days, I would say why it is increasing, or why we are finding more girls and teenage girls and young, childbearing age group females coming with PCOD is the stress that we have. The stress definitely has a direct connection with PCOD. Faulty lifestyle, sedentary lifestyle, I would say, weight gain, because again PCOS has a cardinal three principles symptoms, I would say. That is, one is inflammation happening in your body. So even if you have a GI disturbances, if you have inflammation anywhere in the body, you are more prone to the PCOS syndrome. If you have genetic predisposition, your mom, your aunt had it, you will have it. Third is like it's what to say, the stress during in the school days. I would say academic pressures these days are going really, really too high, because of which the kids are not going out and indulging into the physical activity. That definitely leads to the insulin resistance, and then definitely leads to the weight gain. So PCOS is something, there is no treatment as such for PCOS. It's only that because the symptoms, like we have too many follicles. It's a multiple follicles in your ovaries. You tend to gain weight. You tend to have irregular periods. You tend to have infertility issues because of that. You tend to have depression and anxiety because of that. So I think weight loss, healthy diet, healthy regime, proper workouts, and reducing the carbs and sugars in your diet has definitely helped my patients to take control of their PCOS. And that's it.
Dr. Akshay, what is your views?
Yes, I completely agree with Dr. Sonali when it comes to the high stress levels and how inflammation plays a role, and there is insulin resistance. So, speaking of insulin resistance, I came across a very interesting literature lately, and it spoke about the root cause of PCOS. Now, stay with me here. Apparently, the root cause of PCOS is nothing but hyperinsulinemia. So excess insulin in your blood actually causes PCOS, is what the latest research says. So how this works is, so we know that PCOS is basically an issue with excess male hormones in the body. So your ovaries, along with estrogen, along with progesterone, it also secretes something called testosterone, which is the male hormone. But normally, in a normal female body, that testosterone is converted into estrogen, into the female hormone, and the physiology is balanced and homeostasis is established. But what goes wrong in people with PCOS is this testosterone or the male hormone is unable to convert into the female hormone because of the interference of the excess insulin. So now, because that's happening, the male hormones go haywire, they go all throughout the system. And what the insulin also does is it interferes with the functions of the liver, and the liver produces a certain substance called sex hormone binding globulins. It's a substance that basically takes out the excess testosterone and removes it from the bloodstream. So what insulin does is it goes and prevents these SHBGs from being produced. So there's nothing to control the testosterone. So it goes all haywire, and that produces the facial hair, the cystic acne, the male pattern baldness that women get in PCOS. And so that's essentially what's happening. So if you want to tackle PCOS, you have to tackle the root cause, which is excess insulin. And the only way to go about it is two things. One, intermittent fasting to give your stomach a break, to give your cells an opportunity to utilize the excess glucose that is already reserved over the so many years that you've been eating so much of food. And B, low carb diet. So whenever you eat, you're not spiking your glucose levels. If you don't spike your glucose levels, your insulin levels don't spike, and everything is balanced. This is the way to go about it, according to me.
Very true.
Our next question would be
Wait,
like,
Akshay hasn't given his views about because he has been specializing in that, treating some of the people of that ailment. So we'll wait for Akshay to give his views on this.
Yeah, so
Yes.
I think what Dr. Akshay and Dr. Sonali has almost covered all of it. There's the thing that I can all say is that yes, I totally agree with what they are saying. That's what really happens. That's the physiology. What Dr. Akshay told us is the physiology of how PCOS develops in a female. Insulin, most of that's what I said, that PCOS, the most common one, 70% is insulinogenic PCOS, and that is happening because of this excess insulin in the system. And that is happening, number two, one, either you are excreting a lot of insulin, your pancreas is making a lot of it, or you are unable to process the existing insulin in the bloodstream. Now, either you are not doing the required physical activity, which is required for your body to, just, you can say that, pick that insulin and put it in the right place. At the same time, if your pancreas is producing more than the excess, that's because probably people with diabetes issues, this is what happens. They have high insulin levels in the body. So happening because of inactive lifestyle for long years. So it doesn't develop in like 1 year or 1 month. It happens due to inactivity for over a long period of time. But again, for some females, it's genetics. For some females, there are other lifestyle disorders which lead to PCOS. So yes, these are the core areas. Diet, nutrition, exercise obviously is the solution, or self-care solution. that anybody can take. Obviously, there are clinical things that a person can do, but yes, this is how actually PCOS develops in a female body.
My next question would be like, how do you handle patients who have depression? How do you handle such cases?
To whom? Me?
Yes.
Okay. See, Pallavi, frankly speaking, depression is a very broad terminology and many times misinterpreted word actually. If I tell you the common symptoms of depression, you'll wonder all of us must be having depression right now, because there is a lot of symptomatology of depression. See, when a patient comes to me and he or she says that I am depressed, see, first of all, I just tell them, I hear them out. I keep the psychotic treatment symptoms and the somatic symptoms, like the bodily symptoms, separate. I give more stress on the time from when they have started experiencing these symptoms, and I keep listening to them. I have a very patient ears to hear them out for a long time. You have experienced that. So just I listen to the patient carefully, make a proper chart of their symptomatology, call them for the second visits, get reassured myself that these symptoms are again happening again and again. And then when they tell me typical symptoms happening again and again in their case taking, then I get really I'm sure about it that they are suffering from some mental illnesses, and then I tackle. Definitely, the main focus is on psychotherapy, and then comes the medicines. See, any being depressed, being angry, or feeling a suffering is what we are, being human. So I don't think that just by feeling low one day or feeling that loathing for a few days will call anybody that he or she is depressed. So it's a very broad terminology, and it has become a big taboo these days. People don't talk about it. Mental illnesses needs to be really spoken and discussed properly. It is just, I always say that mind is like a parachute. It when it is open, it works. So it's like that. If the parachute opens on right time, the landing is smooth. If the parachute opens at wrong altitude and less height or a wrong way, then there is a crash landing. So similarly, if one emotion is triggered for a quite long period of time, maybe anger, maybe low, maybe not feeling worthy, or maybe feeling withdraw feeling withdrawn from the world, or feeling like neglected, if it is happening for a prolonged period, then only such we can action. See, once in a while phase, because being female, I'm not talking about males right now, females, because during PMS also they do feel depressed. So every month, if for 4-5 days you are feeling low, that doesn't mean that you call yourself I'm a depressed patient. So it is a phase. Your hormones play a big havoc in your body. So please understand, many times you have an underlying thyroid, you don't know. So first you have to treat what exactly is at the base, and then label it. So I would definitely be give more stress on hearing my patients out, and then letting them, making them that comfort, giving them that, transferring that comfort to them, so that they discuss everything under the sky to me, their feelings, their vulnerabilities, and then I come to the point that yes, now really I should pick these early signs of depression and I should treat them.
Your inputs for this, Akshaya? What do you think
Um,
about this?
So I completely agree with Dr. Sonali when she says that there isn't a one-size-fits-all solution when it comes to depression, because it's such a vast term and there's so many possible reasons for why one could be depressed that we can't say, okay, so I'm going to give you this, you're going to be fine after this. It's kind of like you've got to play with the treatment ball, to throw a bunch of things at the wall and see what sticks when it comes to depression. But I like to, apart from what she's addressed, two other things I'd like to address are, first in the physical level and second the spiritual level. So physically, one thing I like to talk about is movement. So movement and emotions in the mind are very closely associated. So it's for some people, it's very hard to stay depressed if you're moving constantly. If you're like doing something physical, if you're staying active, it's hard to stay depressed. So what I
Yeah.
recommend to people is sprint, jog, do some aerobic exercises, things that require oxygen. Go for some high intensity interval training, anything that will get your circulation to, get back the circulation that's flowing through your system so it can balance out the hormones, because we don't know what's happening. So you got to trust the body, just get the blood flowing. So a little sprint, a little jog will help with that. Another thing that I recently read was apparently depression has been linked to vitamin B3 deficiency and L-tryptophan deficiency. So we could replace that. So vitamin B3 deficiency comes from, like either excess alcohol intake, or if you're having corn and corn products, or if you're on a very high refined grain diet, so, breads, pastas, and all these things that, a normal Indian diet has, rice, wheat, we have all of these things. So it's very likely that it could be from a vitamin B3 or an L-tryptophan deficiency. What do we do about this? Vitamin B3 apparently, for vegetarians, it's really not available, because if you look it up, it's like, liver and fish and poultry. So vegetarians are like, oh, so what we can do is trust the body, know that it will get its vitamin B3 somehow, equip your body's stomach, equip your body's GIT to absorb whatever comes its way. The only way to treat your GIT first is through lactic acid. So I recommend kombucha tea once a day, early in the morning on an empty stomach, that has the exact it has all the ingredients and the lactic acid that's needed to repair your GIT. And another thing I really recommend is, along with kombucha tea, is fermented veg. Like sauerkraut and kimchi. These things, like, it's there for a reason, because the fermented vegetables are high in lactic acid. But in India, I know, like, where am I going to get kimchi from? So the best thing that we Indians have is buttermilk. It's right under our nose, and we just choose to ignore it. It hydrates your system. It's easily absorbed by the body. It has all the right electrolytes, all the lactic acid that you need, all the repairing ingredients that it needs. So 2 glasses of buttermilk per day will take you a long way when it comes to the physical development and the spiritual involvement. So I feel sometimes depression comes because maybe it's like a existential crisis. That happens to, like, most of us these days. So we're like, oh, what is happening? But why am I here? And those kind of spiritual questions. I think then dealing with it in any other way is really not going to be of much use. You have to get to the root of it. You have to find some sort of meditation to help you, get through that. You have to get to the crux of your spiritual core, and that, I think, is really, at the end of the day, will take you through away from the illness.
Anything you want to add, Yash, for this?
Yeah, I think that's the beauty of science. It starts at depression and it ends at buttermilk, So that's what science can do to you, So I would say that, it's amazing. Like, listening to Dr. Akshay and Dr. Sonali speaking, it's really wonderful. I can speak on a practical perspective, what I come through with clients on a daily basis. Depression, right? Now, I get females, I've coached almost 1,300 plus females by now in my 1,800 people. And most of them have been suffering from one of these lifestyle disorders, PCOD or hypothyroid. Now, they come with a reason, and most of them, I would say, somewhere down the line have depression. Now, what I understand depression or about depression, I'm not into clinical depression, but what I understand about depression is that it's either one of these causes. My relatives do not give me the right amount of, focus or the right amount of treatment that I should get, or I used to get when I was, when I just married my husband. My in-laws are not treating me well. Or on the other hand, I'm not fitting into my jeans. I'm not fitting into my old clothes. These kind of things physically, I'm talking about physically, not spiritually. I'm not into that. But physically, these are the things that would generally put a female into depression slowly and gradually. And over years and years, when they go to their kids' PTM, parents-teacher meeting, they see other moms fit and fine. And then they look at themselves, they come home, they look at themselves in the mirror, and they're like, why am I fat? My kid's best friend's mother is so fit. So these are the reasons which I think somewhere down the line keeps on depressing them and keeps increasing these kind of issues inside them. It builds up. Yes. And once, when it comes out like in a very weird ways. And I deal with these kind of calls on a daily basis, just they cry out loud about it. They're like, help me, do something about it. And I'm saying, yeah, it's working, we're working towards it. It's a slow process, but definitely we can work towards it if you think positively. And I also read one more thing about depression, that exposure to environment, 30 minutes of exposure to environment, early morning, going into the garden, taking a morning walk, also helps you deal with depression. So I think that's one of the insights that I also read. So that's what I can add to it. Thanks.
Yeah. And in the beginning, I mean, you were saying, Kaushik, that sleep is very important, right? So we have a question from one of our viewer, Rani Shrivas, and she says that how do we get good sleep? Any tips on that?
Yeah, a
Apart from,
couple
of
of
course,
tips that
avoiding
I
Netflix.
generally
Yes.
yeah,
Yeah,
the couple
Shweta,
of tips that
tell
I
me.
generally give to my clients is number one, you avoid drinking any caffeinated drinks post 5 p.m. or 6 p.m. If you do that, then that deprives you of sleep. Number two is exposure to light. So watching TV screens, watching mobile phones. That exposure to light basically delays the excretion of melatonin hormone, which is very sensitive to light. And melatonin is the hormone which actually induces sleep in the body. So it releases somewhere around 7, 8 p.m. and then acts up for 3 to 4 hours later, around 11 or 11ish p.m. And that's when you fall asleep. So if you have exposure to light between that 7 to 11 time period, you are most likely to get deprived of sleep. Number three is do not drink too much water post your evening time. Like if you are drinking too much water post 7 p.m., that is actually going to not deprive you of sleep, but it is going to wake you up in the middle of your sleep. So you would not go into the REM cycle. REM cycle is the deep sleep. It is only for 1 hour or so at night, which actually makes you recover. But if you're not going in the REM cycle and you're waking up midnight, then it's not working for you. So you are going to be sleep deprived. So these are some of the things that I would say, and have a good some people would say that don't eat heavy dinners, right? I contradict that. What I have read and what I have practically done is that if you have a good dinner, a full filling dinner at night, you actually sleep well. And the better you sleep, the better are the recovery and the better are the hormonal processes in the body. So these are some of my tips that I would generally give to have a good night's sleep.
Dr.
I would just
Sonali, do
like
you have?
to,
Yeah.
I would just like to add what Yash has said, that why the meal at night is so important. See, you can have dinner, you can cut down on the carbs, but you should have a nice sumptuous fiber and protein diet so that you feel satiety, you feel filled up in your stomach, because it's a common thing that, when you eat, your entire blood supply transfers from your brain to the stomach for the digestion process. So definitely you feel stress free, you feel like getting dozed off, so that gives a good sleep. So many times when I recommend my patient that have an early dinner, maybe around 7:30 and 8ish, I keep telling them that before bedtime, just have a half cup of lukewarm milk without sugar, and trust me, that is a wonder thing for getting a sound sleep. So that definitely, because the half cup of milk keeps the stomach engaged throughout the night and has a blood supply to it, so that definitely the brain gets that relaxation. So that's one thing.
Dr. Akshay, you have any tips?
No, I think
Apart from what? Yeah.
they both pretty much said it all. But my father actually suffers from insomnia, and the thing is, it's been, I think, over 10 years, and he's tried most of these things, and it hasn't worked for him. So I know that sleep is, it's a very sensitive topic, and there's not much research in that. We still don't know like what is the right solution to like, get that good night's sleep. But what my dad used to do was actually used to try this breathing technique. So he would do like 5 minutes of Nadi Shodhana Pranayama before falling asleep. And it actually helped him for a while back there for like a couple of months. So if that helps anyone, if that's of help, that's great.
Well, if you're talking about things that help, I would like to add one thing over here. So there are research supplements, well-researched clinical supplements that can actually help you fall asleep. One is the hormone that I was talking about, melatonin. That's one of the, like, it is also available in tablet forms. So if you take that, it induces more sleep, like quicker sleep in the body. And there are practical examples I've seen where its insomnia has been treated by taking melatonin as a supplement. Second is zinc and magnesium. So there's a supplement called ZMA that is in the market, very easily available. ZMA is also one of the supplements that also helps you get a better sleep. Zinc and magnesium are two of those minerals which are mostly deficient in Indian non-vegetarian diets. So if you want to have that ZMA as a supplement, that would also help you with better sleep. So if you talk about supplements, I think these are the two most renowned that I've heard of as of now. And if I come across, I'll share more.
And there's one question before we end. We are almost coming to the end of this. There's one question that has been coming up many times. What is the maximum time for intermittent fasting? This has been asked by Pallavi, and this question is coming repeatedly by many people. So I thought before we finish, we'll just add that one question.
I think 18:06 is a good start. I mean, it's not a good start, but 18:06 is the ideal. So, sorry, what am I saying?
18:06 window.
16:8. So you eat for an 8-hour period and you fast for a 16-hour period. That's the ideal. But again, it's, I suggest people go with when they feel hungry during a day. So suppose some people, their natural hunger pangs kick in at 7 a.m. For some people, it kicks in at 11 a.m. So let's start counting it from there. So every body is different. So every body's timings will be different too when it comes to intermittent fasting.
Okay. So I think it was really lovely talking to you all. And on behalf of Karnataka, I thank the esteemed panelists for giving us this time. And good night and thank you so much. And this is Kanasada Suvam signing off.
Thank you. Thank you for having us.
Thank you for making us a part of it.
Everybody.
Thank
It was
you.
a very nice session.
It's a pleasure.
Thank you.
Same here. Same here.
Have a great evening.
Have a great evening.
Thank you. You all. Bye bye.